My name is Vimal Gokani. I'm a plastic surgeon in London. And today we are recording a Giants in Plastic Surgery podcast live at PSTM in New Orleans. We have got a very special guest on with us on Giants in Plastic Surgery today. Someone who genuinely needs no introduction. And when you say that, normally you're supposed to give an introduction. But I'm not going to today because this man genuinely doesn't. And we're going to spend the next 45 minutes reminding ourselves exactly why. Dr. Kevin Chung, a very warm welcome.
Yeah, thank you. Thank you, Vimal. Appreciate it.
Firstly, can we call you Kevin? Is that okay?
Okay, absolutely.
So this podcast series looks at the journeys, looks at why you've made the choices you've made to end up at the dizzy heights that you've ended up in. So my first question is, where did it all start? Did you always want to be a doctor?
Our life is filled with circuitous routes. And if we know what we know when we're younger, there's no way we're going to retrace that life. So because my grandfather was a physician in Malaysia, and he has all 12 children, and my grandmother is so doggedly determined that if you're not like her husband, you are not going to be successful. So we come from a medicine family. When I was very young, my parents were not physicians, but they listened to my grandmother and said to me and my brother, "Oh, you had to be physicians." And I have no idea what physician is. So when I went to Emory Medical School, walk into a cadaver session the first day, I go, "Oh my God, this is what I've chosen." So in our, as you know, in our Asian culture, the parents tell you, "You're going to do this, just do it." The good thing about medicine is that medicine has so much diversity that no matter what kind of person you are, you can find a niche for yourself. So from that standpoint, it just worked out really nicely for us.
But you went to college and med school in the States, but you weren't born in the States, were you?
I was born in Taiwan, so I left Taiwan. We left Taiwan for my father's job and lived in Singapore. When we left when I was age 6, and we lived in Singapore from 6 to 15 before coming to the States.
When you moved to the States, what are the biggest differences you noticed between Singapore and the States as a child, I suppose?
Well, because you're so young that you have no idea what's happening. And I distinctly remember that because at that time, Singapore is mainly a Chinese education school. Until when I left, that became a bilingual, trilingual institution where English is the major language. So I do not speak a lot of English when I come to the U.S. And when I came in as a 10th grader, they say, "Well, you need to pick a second language." I go, "Wait a second. How about English?" "No, pick something else." So I had to pick English, I had to pick Spanish. Like, what are you talking about?
So when you come here at the age of 15, you're learning English, you're learning all the subjects in English as well. And then you kind of went to med school. What was was it a family decision saying, "Hey, Kevin, look, we want you to be a doctor," and that was just it? Did you ever want to do anything else?
Well, it has to be determined that I'm going to go to medicine. So in terms of everything else, it's not an option.
It wasn't an option. Okay. And so take me through the rest. Continue your journey. You're at med school. After you finish med school at Emory, where'd you go for residency?
And that is the closest route. So at Emory, I was going to be an orthopedic surgeon. And Emory has a big hospital called Grady Hospital. That's a charity hospital in which our job as medical students is to wheel patients around everywhere.
Yeah.
And I was wheeling my patients I remember, to MRI. And MRI machine was broken. So I was sitting there for a while trying to maneuver and get an MRI for this patient. And 3 hours later, I realized that my meeting with the orthopedic chairman, for him to write a letter for me to go to orthopedic surgery, I totally missed it. And so from that standpoint, I'm going to go, well, you know what? How about I just do general surgery? Let me tell you guys, if you guys want inspirations about planning your career, I'm not it, okay? Everything is circuitous. Things happen, and I just said, okay, let's do it.
But they happen for a reason, don't they? I mean, although you didn't do orthopedics, you've ended up with a very orthopedic slanted subspecialty subsequently. But we'll get on to kind of why you've chosen hands later on. Okay, so you've done general surgery. You didn't like general surgery? That wasn't for you?
It's quite interesting because general surgery should be a distinct specialty because, we do so much of everything. We do thyroids, we do intestines, stomachs, we do trauma. It should be self-sufficient. But for some reason, in our era, when you do general surgery, you're supposed to be subspecialized. And when you go to a Texas training program, my program specializes in cardiovascular surgery. And I was going to be a cardiovascular surgeon. However, because of many different factors, cardiovascular doesn't seem to be the right choice for me because of the repetition of the operations and so forth.
Yeah.
And all of a sudden, kind of go, what? You know what? Okay, plastic surgery.
So did you do a rotation plastic surgery and kind of fall for it? Was there actually something or someone who made you think I like plastic surgery?
Right. We have a young attending called Chris Peterson who came, and he was trained at Duke, and
Yeah.
he was an alumni from San Antonio. He came back to be attending. He's very enthusiastic. We all like the stuff he's doing. And he said, Kevin, why don't you go to Taiwan and spend some time with Fu Chang Wei, see whether that's what you want to do. So I spent a couple of months with Fu Chang Wei, come back, kind of say, I can do that. So I picked plastic surgery for that reason.
So when was that in your training when you went off to Taiwan?
4th year of general surgery training. We have a 5-year general surgery program training.
Yeah.
And so you had to make a decision about your fellowship. So the 4th year.
So it was Dr. Peterson and Fu Chan Wei who kind of helped you to make that decision of doing plastic surgery. So where did you do your plastic surgery residency?
And I went to University of Michigan in plastic surgery.
Good place to go?
Nice. I mean, I've been at University of Michigan for 33 years. And life took a circuitous path. You're going to ask me, oh, you do plastic surgery, then why do you do hand surgery? Well, because Michigan went through a transition period in which there's virtually very little hand surgery. And I figured that as a plastic surgeon, if you can do craniofacial, you can do lower extremity free flaps and stuff, but you're deficient in hand surgery, you got to complement that. You got to have a hand surgery training. Not because I have this amazing love for hand surgery. I figured that I need training in hand surgery, so I batched in hand surgery.
So, but then you've subspecialized into, well, do you do anything else apart from hands at the moment?
Yeah. For a long time, I think I would say first part of my career, I'm a whole body surgeon. I mean, not only do I do hand surgery, I do free flaps to the head, I do some head and neck surgery, I mean, everything that comes in, I do it.
Yeah.
But our practice has grown so exponentially that I do really complex hand surgery procedures, such as rheumatoid arthritis, trauma, congenital, and so forth. I think that's my practice right now. It's just doing the things that people cannot do and don't want to do.
When is the right time to limit your practice as a plastic surgeon? Should you do that in residency? Should you do that in fellowship? Should you do that in the middle of attending years? When should you say, look, I no longer do trauma, I no longer do cancer, I no longer do free flaps? Or when do you limit your practice?
It's a great question. I always reflect that, during your training, you're in training because you have such infrastructure around you that you feel the operation just went so smoothly, so easily. But the reason it went smoothly and easily because someone set it up for you. And when you go by yourself, for the first 5 years, you're learning to be a surgeon. You're learning to be a surgeon as a lifelong learning. And the devotion to be technically gifted, the devotion to being able to finish your operation efficiently, and also the ability to have very little complications. And that's a mark of a surgeon who reflect and learn and be articulate in one's craft, which means that when you need to learn how to be self-specializing and focus on certain area, you don't have to think very much because you just have to make yourself be a good surgeon, and a path will come to you.
Do you think that comes organically then? It's not a decision that you make, it's a decision that is made.
I try not to have these long-term plans. And why is that? Because I mean, we are so small in the whole universe, right? If you see the sun, a sun is a very small thing in the whole universe. And then if you put the sun next to the earth, we're like those tiny dot. And within this tiny dot, there's 7-8 billion people. So why do I think that I can make a craft for myself? Things happen for a reason. And when it happened, I did my best. And that's,
I bet nobody thought they were going to get an astronomy lesson today.
I know, because this is an interview. So we're not scripted. Whatever comes to my brain is going to come to you. So if you hear me saying something crazy, you go like this. And I'll stop.
And so what is it that drew you to hands then? Because I know lots of people who do a bit of hands and will also do some body contouring or something else extra as well. But what is it that drew you specifically to hands?
So interesting. I think that hand surgery, I mean, after I learned about hand surgery, when I go back to University of Michigan, because we're a major tertiary referral center,
Yeah.
complex stuff come to me. People with severe rheumatoid arthritis, congenital problem, bad trauma come to us. So you have to be really elegant and be efficient in doing surgery. And I found out that the hand surgery gave it the avenue to be expensive because for a trauma patient, I need to know how to do bone. I need to know how to do wrist, bone stuff. And then after that, I need to do nerves. And after that, I need to do soft tissue. I mean, all the complement of what a plastic surgeon should be able to do is contained within hand surgery, particular in a complex trauma setting like University of Michigan. So for that standpoint, because I found out that I'm able to see an operation 3 or 4 steps ahead. I can see things before I do them. And that's come with training, also come from reflection and so forth. And I find that hand surgery gave me that challenge.
So it's anatomical fear of missing out, isn't it? You just didn't want to lose an anatomical structure, which is what drew you to hands then.
Exactly.
So we've got the whole clinical side up to a point here. What about other things, kind of family and sports and anything else just to keep yourself sane throughout that time? Did you have time for anything else or was it just work?
Well, that's a really good question. And the thing is that I think that my wife and I have decided that because I have one life to live, and my life should be devoted to something that's beyond my immediate family, which means that my wife gave me the long latitude and leash to be able to take care of patients. Because I mean, as a busy surgeon who does surgery, who does research, who travel and meet people, and also to do volunteering work, it's 4 lifetimes in one lifetime. And so my wife and I have a contract. You fend for yourself, and I'm going to take care of my patients. No. Is this recorded? It could be a problem. No, she's very kind. She's very kind that she understands that the things I do, the things we do, is so important to humanity. And so we have one child, and my wife gave me tremendous latitude to do all the things that we need to do.
And do you have aspirations for your child? Like, have you told your child you're going to be a doctor?
So my aspiration for him is that my wife look at him and kind of go, do you want to be like your dad? So my son is not in medicine.
Fantastic. And what keeps you busy outside of work? Because you must have something just released, just to stop yourself from burning out. Are you a golfer? Do you deep sea dive? What keeps you ticking?
Yeah. A lot of times we consider work as so-called work, and then life outside of work as outside of work. I don't have that concept. I feel that everything's integrated. I mean, I don't consider me going to take care of patients as work because we interact with people, we interact with patients. My patients love me. I love my patients because when I see them, I don't want to see them as an operation. I want to see them as someone I want to know something about. So my patients and I have a very good dialogue similar to this. I want to know about the family. I want to know what the aspirations. I want to know the financial situations. Can they afford the surgery?
Yeah.
And then we can pick an operation that they can actually afford and be successful.
Yeah.
I want to know them. So my patients stay with me for a long time. So if you think about work, it's really not work. It's part of so-called my sphere of influence and my family within my working space.
What a healthy way to look at it, because that's a way of kind of avoiding burnout, isn't it? In reality, because everything is fun, nothing is work.
Burnout is interesting. I just read something recently about burnout. Burnout is, people misconstrue burnout as being so taxed with work they cannot do it anymore. Burnout is when your work is not being appreciated. When you feel that you're doing a mundane task that benefits no one. And those things causes burnout. It's not because of hard work. It's just because of some peripheral psychological concerns that cause burnout. And I told people that, and people ask me, Dr. Chung, how do you avoid burnout? I told them, it's very easy. If I feel a little pang of burnout, I work harder so I don't remember the burnout. No, just kidding. So they look at me kind of go, okay, well, I'm not going to take advice with this guy. No, that's not true. I think burnout is is you got to find purpose in what you do. If you find a purpose, you're going to put in the extra effort, and burned out will not be an issue. However, when you have no purpose and when you feel that you're not appreciated, it's time to move.
Yeah. How interesting.
What do you think?
I don't know. I'm too burnt out to think about it. No, I think your views is absolutely right. That aim without a purpose is exactly what burnout really is. But you've, as you said, you've had multiple. So I'm not going to ask you about your financial situation at all, like you asked your patients. So don't worry. I'm gonna.
Oh, you can ask me about. Let me talk about my financial situation.
Oh, we haven't got time.
No, this is actually a good discussion. I wrote a paper recently about minimalist lifestyle. How interesting. Because I absolutely admire people like Gandhi, who's trained as a lawyer in UK, but went back to India to rejuvenate the whole country. He realized that all the stuff around you are distractions. He realized that the suffering that we feel, the agony we feel, be because of unrequited. I mean, because we want something, we can't get it. And his feeling is that he wants to give, all these material things away so he can be singularly focused on what is meaningful.
Yeah.
And so this paper on minimal lifestyle is that, I don't want to own a lot of stuff because everything I own is going to cloud my judgment. And so I live a very simple lifestyle. I don't even know what my bank account number is. Someone knows. There's enough money in my pocket that would not get me in trouble.
Okay.
There's not much money to get in trouble, but just enough to survive for the day. How's that? That's my
perfect philosophy. Perfect philosophy. So you've had a number of leadership roles as well throughout your career. I mean, chair of the department, obviously, but also you've recently demitted as at the helm of PRS. What have you learned from those leadership roles that you can apply to each individual patients?
These leadership positions, the reflection of these leadership positions is that people always say servant leadership. Do they actually mean it? I don't know. When they say servant leadership, sometimes leadership induces people to get power, to be able to influence people to a direction they want to do.
Yeah.
When I assume so-called leadership position, I'm a facilitator. I want people to be successful. I want people to be happy through what I do. As PRS editor, it's so important for me to be sure that the reviewers, the editorial board, the staff, all get the credit for everything we do. And I want to be highly respectful of the authors who trust our journal and put the papers into our journal. And regardless of what decisions, whether accepted or rejected of the paper, they need to feel that the process is absolutely fair.
Yeah. Does it feel fair to authors when it comes back? Because the 3 different reviewers are saying 2 or 3 different things, sometimes which are opposing each other. I mean that's difficult. I mean we've got something like that at the moment, and I'm not going to ask you for advice right now. No. And what about building a department? So you've been chair of the department at Michigan, at Professor of Plastic Surgery, Professor of Orthopedic and Plastic Surgery. How do you then think about developing a department? How do you decide, well, this is a gap in the department and we need to fill it?
Yeah, that's a good question. I'm actually not the Department of Surgery chair. I'm not even the chair of plastic surgery. However, I run the hand surgery service for many years. And hand surgery is quite unique because it is a combination of orthopedic surgeons and plastic surgeons. And that competition has been very keen in the US for some reason, because for some reason, people think that hand surgery should belong to plastic surgery. Hand surgery should belong to orthopedic surgery. That kind of rift between 2 specialties is ridiculous, because our training model in Michigan is that if you call a hand surgeon, you got to be able to do everything from bone all the way to soft tissue. When my orthopedic surgeon colleagues do complex hand trauma and they do soft tissue, you should not be able to tell that they're orthopedic surgeons. When I do bone, when I do elbow, distal radius fracture, wrist and stuff, no one should be able to tell that my background is plastic surgery, even though I'm training orthopedic surgery. I think that integration is so important in our specialty of plastic surgery, because we work with so many different people. We work with cancer surgeons, and then we do reconstruction. We work with pediatricians. We take care of people with congenital problems. I think that integration is the foundation of our specialty. We need to bridge the gap, and we should not compete and cause frictions among specialties.
But I mean, in everything that we do, we have integration with other specialties. We we operate from top to toe, front to back, young to old. But in every single one of those permutations, there is the opportunity to collaborate with somebody else, or the opportunity to push somebody else out. If you just take head and neck, for example, there's a rift in head and neck surgery at some levels. And do you think that rift can be repaired?
So the thing is that that's why, I mean, as PRS editor, it's so important that we maintain every single subspecialties in plastic surgery.
Yeah.
And why is that? Because, our forefathers and mothers gave us this wonderful specialty. And if we ever lose anything just because of inattention to our colleagues and not available to help, once we lose it, it's gone. Okay, let's take head and neck. Head and neck is something that we have championed, reconstruction and so forth. Many countries are still focused on head and neck surgery. However, in the US, we have lost head and neck surgery because I think there's a variety of reasons, but primarily because the surgery is late and the plastic surgeons are not available to do reconstruction, which forces our ENT doctors to learn about free flaps and learn about reconstruction, and they take over. So other than select places that do head and neck surgery, we don't do this. In other countries, you still do head and neck surgery. So I implore everyone in plastic surgery that be available, protect our specialty, be available to help.
Yeah.
And when someone asks you to do breast reconstruction, make it happen. Because if you are not available, they're going to find a way to reconstruct, and then you're irrelevant.
So we spent some time giving kind of reflections and advice from you, but who are the people kind of as you were coming through who mentored you? Who are the people who you would turn to for advice?
Yeah, that's a really good question, because I wrote some papers on mentorship. And I think that's so important in one's formative years to have someone you can trust as a mentor, someone you feel comfortable to give you advices in terms of how to avoid conflicts, how to choose a job, and many of those things. I didn't have that opportunity because by nature, I was actually very quiet. And my goal was to be sure that I hide under the radar. And when I finished my general surgery training, I overheard my chief goes, who's that guy? Did he train here? And I felt that I'm successful because I always wanted to fly under the radar. I don't have a particular mentor, but what I feel that my mentors are usually my patients, because I collect pictures. Every patient comes to see me. I have pre-op, intra-op, post-op. And every 2 weeks, I will look at all my pictures so I can reflect, because most of the time the operation is done beautifully. If I do it beautifully, I want to do it again.
Yeah.
Some of them, I look at it kind of go, it's not perfect. Even though the patient feel that it's wonderful, I feel I can do better. And that reflection is so important in our specialty. And I feel that I would say, if you were asked me who are my mentors, I would say my patients. That's because I spend so much time analyzing my results and be reflective.
But that's a great bit of advice. What other advice would you give to your younger self from, say, 20 years ago? What do you know now that you wish you knew 20, 25 years ago?
Yeah. No, I wish I'd be more open to look around and say, who can I trust? Who can I share with my difficulties? Who will be unbiased and also be sympathetic to give me honest feedback? I think that that would probably help me avoid some of the missteps in my career, because someone is willing to look at it objectively from a third-person standpoint and say, you should do this because of this.
Yeah.
And many of us don't have coaches. And you cannot play sports without a coach, because the coach, let's say football, the coach will look at your film to see how you use your hands, to see how American football, not this thing. They will look at the films, they look at the quarterback needs to know where the defense is. I mean, those coaches are so important in the growth of a young person. I think that in surgery, it's so helpful to have a coach, particularly a coach potentially can look at a video you doing surgery and kind of say, look at this, what do you think? Not being judgmental, what do you think? How do you analyze your hands? How do you analyze you pick up the instrument? And by doing that, your growth will be so much faster.
But you're absolutely right, aren't you? Because if you're an athlete, even as the world number one tennis player has a team of coaches to help them be even better. Yet the second you become an attending, that has a risk of just going, doesn't it?
That's right.
You're absolutely right.
When someone tell me, oh, I do 1,400 this operation. And I think that the reaction from me is, oh, I'm so impressed. I'm not impressed. You maybe do 1,400 of the operations incorrectly, yet you do not know that you did it incorrectly. But if you were to do 10 of them and reflect on them, that's more valuable to me than, let's say, 1,400 of the same routine without any modifications, without any advancement, without any self-critique. Yeah. And that's where coaching comes in.
Absolutely. So what's next on the horizon for you? What's your kind of 5-year plan now?
Oh, I just shared earlier with you is I have no plan. My plan is have no plan.
I just have no.
My plan is get over this interview without saying something crazy.
Too late.
That's being recorded. I think that when you have these kind of interviews, when I go visiting professor, I need to be totally transparent. Because, no one wants you to come to the institution for you to give a fictional, artificial message that you think they want to learn. I think that they want to see who you are. They want to hear about your experiences. I think that in any kind of interview setting, in any kind of visiting professor setting, it's so important that the visiting professor, so forth, it's clear in what he or she experienced. Whether it's right or wrong is another story.
Yeah. Kevin, it's been absolutely lovely talking to you for the last half an hour, 40 minutes. One more question, if I may. If somebody says Kevin Chung, what 3 words would you want to come to mind?
3 words. Wow.
That's one word.
That's a good question. I would say simplicity. I would say genuine. I would say pride. And I think the last word is important because whatever we do in life, we have to do it in pride. Martin Luther King said one thing, I paraphrase it, is that if I'm going to be a street sweeper, I want to be the best street sweeper ever when heaven and God look at you kind of say, that is the best street sweeper. And I think that whatever we do, we have to have pride that we're going to put in, invest in everything we do. Someone running this meeting, it's going to be a beautiful meeting because someone put the pride before themselves.
Kevin, thank you so much. To me, yours is a story of hard work, openness, and jovial fun. Thank you very much for the interview.
Thank you so much.